Hello, everybody, and welcome once again to Functional Medicine with Dr. Robbins, me. Our show is dedicated to giving you safe, healthy, and effective ways, natural ways of dealing with diseases and conditions that basically people can give up hope on trying to help. And in many cases, able to get rid of them permanently, completely, once and for all. So that's what our show is dedicated to. And today we're going to talk about Meniere's disease, Meniere apostrophe S, Meniere's disease. Before we get into that, let me thank my two sponsors, which are very important in helping this problem. The first is Doctors Biome, DOCTORS, BIOME.com. Doctors Biome makes a very special probiotic beverage. It's all natural, 100%. All the bacterias are patented strains created to survive stomach acids over 90% and stick to the wall of the gut where you need them. Capsule powders and tablets that have been basically put into suspended animation. If they survive freeze drying at all, most of them are destroyed by it. So you're really wasting your money, in my opinion, buying those products. Virtually, if they do come back to life, don't survive the stomach acid. And if they can, don't have enough time even to grow into healthy adults and populate the wall of the colon. So bottom of it all is nothing like it on the market. And it's delicious because it's in a 100% organic mint kale, mint kale, celery, cucumber, apple, lemon juice. It's delicious. Babies and kids love it as well. Um, so if you go there to doctorsbiome.com, you can get 10% off. I'm going to give you away because it's not a cheap product. Nothing cheap is good and nothing good is cheap. If you use my patient coupon code Howard35. Now, for those of you that are wise, because it's sold all over the world, in the UK, the EU, in Southeast Asia, as well as all over the US. Much of it is sold through doctors' offices themselves, as they've discovered its value. And you can learn more about the value of it if you listen to some of my other podcasts on the immune system and on probiotics. Well, in any case, you can get an additional 10% off if you go on auto ship. They run out of it all the time until the next batch gets released after safety testing. You may not be able to get hold of it, but if you have auto ship, not only do you get an additional 10% off, so now you're getting 20% off that price, but you get priority shipping. So as soon as the batch is released after safety testing, it goes out to you. Very worthwhile. And it comes with a 100% money back guarantee. So if you don't like it, you don't think it's helping you, get your money back. You got nothing to lose with free shipping, of course. Anyway, then as you're going to learn how important it is for this problem, you're going to want to go to Promolife.com, Promolife.com. Actually, it's even best to just call them at 888-742-3404. 888-742-3404. Tell them Dr. Robbins sent you. Okay? Tell them Dr. Robbins sent you. And you'll get something off, you'll get a special deal, something like they always take care of people who tell them they heard about it here on the show really well. You're going to learn why you want to get hold of their ozone products for home care as I do the show when we get into how to treat Menieres. So stay with us. Write it down, 888-742-3404, and you'll understand why. So what is Meniere's disease? For most everybody that's listening to this show knows all about it. That's why they're listening to this show. Some people just listen to all our shows. I don't go into great depth on describing it, but it's basically a chronic inner ear disorder, okay? And it causes episodes of severe dizziness, hearing loss. You can feel like, you get roaring in your ears, a real tinnitus. That's really bad. You, your ear feels uncomfortable and like it's loaded with something. It can come at any age. Usually the people that we've seen and heard with it between 40 and 60, but any age you can get this. Kids can get it. Um, it's thought to be a lifelong condition. Wrong, because we have some answers for it. Um, and all traditional medicine has is ways to ease symptoms up. People don't come to people that we know of want to get rid of it, not just improve it and have to suffer with this their whole life. Um, you're getting things to understand is that your brain, which helps you maintain your balance and everything through what they call proprioception, which gets signals from your feet as to where your body is. Your feet, ankles, legs tell you where your body is at any given moment. Your proprioception is completely thrown off. You'll have an unsteady gait. You may fall down. You could hit your head and get killed. It could be indirectly life-taking, and it has. You'll feel like the floor is moving underneath your feet. It's not stable. A lot of different foot sensations. And just quickly to say, and if you do have that, you want to wear running shoes, athletic shoes, things that are stable on the floor, no high heels, no shoes that can easily slip or whatever. You want to be able to maintain balance at all times as best you can, because you can get sudden numbness, tingling, or weakness in your feet and legs. And so that becomes a very serious issue. Nobody really knows what the cause is. There's some discussion that it may be genetic, but they haven't really linked it to that. Allergies and autoimmune disorders seem to be causing it. I believe Lyme disease may be one of the major causes of it, and they're not diagnosing it as Lyme disease. If you listen to my show called Lyme Disease, the Great Imposter Mimic Pandemic, you may have a lot of other issues that will, symptoms that would indicate that you might have a Lyme infection, even if you've tested negative for it. Certainly, we've seen it can happen if you have a fall or an accident where you injure your head. Inner ear infections have been known to cause it. Viral infections can cause it. And I believe that if you also have sinus infection, viral sinus infections that can put pressure into your inner ear, it may be one of the reasons why people feel it and have it diagnosed as that. Number one treatment for it, intravenous ozone therapy. If you're listening to my shows, I sound like a Johnny One Note. That's why I'm doing these podcasts. We have seen with intravenous ozone therapy amazing things that traditional medicine doesn't have a clue. They don't even know that hundreds of papers exist on the use of ozone to treat just about everything. Because this isn't a common enough problem, I don't know of anybody that's seen enough of it that's written a paper about it. It's one of the things I may get around to doing when we see enough of it. But direct intravenous ozone therapy works on all autoimmune, all infections, inner ear infections. We've seen it work on sinus infections that can cause this, and so on and so on and so on. So, so direct intravenous ozone therapy is certainly the way to go. At least 3 or 4 treatments a week. Unfortunately, it's not available all over the world, or there's many other methods of ozone. If you listen to my show called Intravenous Ozone, Everything You Need to Know, I go over all the different methods and why we use the ones we use. But it's been proven and shown that direct IV and my version, RMD, Robbins method, DIV, has been amazingly beneficial in helping so many different things. It's a simple treatment. You can hear about it on that show. I don't like to waste time repeating things that I've done on other shows. Listen to more than one of my shows. Tell people to please subscribe. I'll tell you that again at the end. It's very valuable and it's free. Okay. So in any case, it's simple, it's fast, it's easy. 3 or 4 treatments a week, though more would be faster and get a quicker result, would be better for this problem. Okay. Um, everybody we've ever heard of that's done direct IV has improved and gotten rid of it completely if you stay with it as long as it may take. There is no set average, typical, usual number of treatments, though. So there's no way to know how many you're going to need to really hopefully eliminate it once and for all. Since we don't know what we're fixing, I can't use the word cured. Technically, that's probably what ozone has done. But if you don't know what what you've gotten rid of, how do you know that you actually cured something? So we tell patients stay on and keep doing therapy once a month. And this way, if you have a return of any symptom at all, you can go full blast right away. You're always a patient. Now, having said that, there's that's why I told you to go to Promolife at 8 and call them at 888-742-3404 and get set up for home care ozone therapy. Now, home care ozone therapy for this consists of 2 things. One, rectal insufflation, which is an ozone enema. This is where you wet your colon with a fleet enema or a bulb syringe using RO water, distilled or purified water, because you always want a wet colon. And then they'll set you up with bags and explain how to do where you squeeze the gas from the bag through a little thin tube, like maybe a rectal thermometer size, but soft with little holes at the end. And you squeeze it into your buttocks and you hold it in and you relax and squeeze more. And you need to do this twice a day, 7 days a week, using a 20 to 40 microgram concentration. I always say start at 20 and build up. All right. As long as you're using their machines and their systems, I'm not concerned. As long as you're using bags, I'm not concerned that you'll hurt yourself. You won't hurt yourself, almost impossible at all, doing it that way. In addition, they sell a product called an Nebulo capital O3 for ozone, Nebulo 3. You're actually nebulizing, snorting into your nostrils. So that may be something that'll help if there's a sinus issue causing this. A Nebulo 3, and you snort it up into your sinuses. You don't inhale it. Please don't inhale it. And then you're using only a 10 to 12 microgram concentration. And you'll see a gas shoot out. They'll be able to instruct you on the use of it. They do that for free. They may even have videos up on their site about it. And this can help fight, if you have a sinus problem causing it, sinus infection causing it. But they also sell a stethoscope kind of thing. And with the stethoscope, you can pump oxygen and ozone gas slowly into your ear. Now, you want to wet your ear first. Just put a few drops of the RO sterile or purified water on your tip, and you can put it in and gently rub it in so you get it in. You don't want to saturate your ear. In scuba, we used to have an expression, don't put anything in your ear smaller than your elbow. You don't want to be poking things in your ear and perforating your eardrum. Although I have to say with Menieres, people often do that because it's just so uncomfortable. They're rubbing and they're pressing, trying to relieve it, and they can often perforate their eardrum or cause infections. So anyway, the ozone gas will go in, and you want to do this in a room, either in a room with great ventilation with a small fan in front of you blowing the gas away, because it's going to come out of your ear and I don't want you to inhale it. So it blows it away and out of the room, because we don't want to be inhaling this. So you have to have great ventilation to do it indoors. Otherwise, you can go outside for a walk and do this. So you just slowly keep squeezing out of the bag that you filled with the oxygen and ozone gas, and it'll go through that into the stethoscope that they sell you, that you'll attach the bag to. okay, and push the gas into your outer ear. Some of it will get into your inner ear, and this can make a major difference in how to in your discomfort and or trouble from this particular problem. Um, you want to, so those are the main ways of treating it. But now there's other things you can do as well. It's been shown that you should go on to a low sodium diet. Try to stick to no more than give or take 1,000 milligrams of salt a day. And we're talking sodium now. Yeah, you can use sea salt and knock that up to even 2,000 milligrams a day that way. But you want to minimize sodium salt. Not eliminate it completely, just minimize it. You want to avoid triggers like caffeine and alcohol and nicotine, which has been proven to worsen things, but basically they work against your immune system. So it would make sense. Got to be well hydrated for the ozone therapy, but hydration seems to be helpful with this problem. You want to avoid MSG, by the way. I remember that. MSG is really bad for this problem. Gentle exercise. I like chiropractic and acupuncture tremendously to help with this problem. Supplements, like any supplements that'll help fight inflammation and infection, boost your immune system, like vitamin C, vitamin A, D, and E, vitamin D3 along with K2, of course, vitamin A, D, E, and C. Ginkgo biloba can help with your circulation with this. Flavonoids seem to have proven, some research has shown that they're helpful. Just about any supplement that's going to boost your immune system is going to be beneficial for this problem. So, in summary, if you have any questions about how to deal with Menieres, you can email me at Ozone Doctor. That's OZONEDOCTOR at yahoo.com. Ozone Doctor at yahoo.com. Or call my office in Manhattan at 212-581-0101. That's 212-581-0101. And let's see. Doctorsbiome.com, because the gut connects to the ear. It's called the gut-ear axis. You absolutely have to get Doctor's Biome to help with this. Doctorsbiome.com. Remember to use my coupon code Howard35. You can go on AutoShip, get another 10% off. All smart moves and necessary. And then lastly, Promolife. Everybody, please subscribe to my channel. Tell your friends and family about it. We're picking up new subscribers all the time, getting a lot of people watching and listening to our shows. I really appreciate all that support that you're all giving me, and I thank you all very much. Stay safe, stay healthy, stay well. So long now.